broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar, GIS and Data Mapping, Regional COVID-19 Response Examples. This presentation will feature speakers from the Atlanta Regional Commission, the Mid-Ohio Regional Planning Commission, and the Central Florida Regional Planning Council. Each organization will take us through some of their mapping products, economic analysis, local government response tools, and community-related resources in response to COVID-19. Mike from ARC will kick things off, but before I hand things over to him, I want to remind everyone that if you have any questions, please type them into the question box, and we will read them out loud at the end of the webinar. Without further ado, I will now hand things over to Mike, Ali, Kobe, and Ryan from the Atlanta Regional Commission.
All right, thank you. And as we're getting our slides up, I'll just do a brief introduction. I'm Mike Carnathan. I head up the Research and Analytics Group with the Atlanta Regional Commission. And part of that portfolio is we run a program called Neighborhood Nexus, which is a community intelligence system. And just like everyone on this call, we've been building lots and lots of tools, lots of information, and really doing a lot of research to try to get an understanding of what's happening. And as you know, it's very hard to start trying to explain what is happening and what's going to happen when things are changing so rapidly. And then you add in the last couple of, because really with the pandemic, you're talking about two crises. You're talking about a public health crisis and you're talking about an economic crisis, and those are both playing off each other and in very important ways that we're all trying to figure out. Now, one of the things that's been introduced recently is, of course, once again, we're talking about racial injustice. We're talking about systemic and institutional racism, and these are the things, and these inequities that are associated with that. These are the things that were really being laid bare, both on the public health crisis side and the economic crisis side, because the disparities and the impacts that we're seeing are completely race-based. And so again, with that spirit, what I'm going to do is go very quickly and talk about some of the tools and some of the resources that we have built, both in the research and analytics division, and also kind of a broader group within ARC as a whole. And one of the first places that we start, and you'll see up here, and this is our open data portal. And we've kind of carved out a hub from our open data portal for just the COVID-19 response. And one of the overarching goals of the research group, of really the Atlanta Regional Commission, is to create a data-driven decision-making culture in the Atlanta region. And of course, that starts with data. And this, in our open data portal, if you Google Atlanta Regional Commission open data portal, you'll come up on our page. And this is really where all of our data is housed. And so we're talking thousands and thousands of variables for every single neighborhood, every single county, every single city, every single school in the entire state of Georgia. And what you're looking at is, again, this hub that we carved out of that points you to some key COVID-19 response resources, including what we're calling a COVID-19 weekly report. And that's something we put out a couple of weeks ago because, as we all know, we're just awash in data. We are drowning in data. And so the idea behind this weekly report is just to kind of give 5, 6 key indicators of what's happening this week, so we can begin to start understanding how things are changing. Are things getting better or things getting worse? And so that's kind of the intent behind this COVID-19 weekly report. But we have lots and lots of other tools out there as well. Colby, go ahead and advance to the next slide. And as I said, we're constantly looking for new ways to explain what's happening. This is a screenshot of our blog called 33N. That's roughly the latitude of the Atlanta region. And that's what happens when you get GIS geeks naming your blog for you. But this blog is our way of just telling stories, of really just kind of picking out key information from the data and writing about it. Because we think, and this is for a broad audience, so we think, just that our audience wants to know what we're thinking about. And this blog reflects that. Let's go to the next slide. And in the spirit of trying to understand, we did come across this really great data set from SafeGraph. And I will put in a plug for SafeGraph right now, because they have some really interesting data that goes down to the neighborhood level that really allows you to analyze and see where social distancing is happening and where social distancing isn't happening. Now, what SafeGraph is they kind of combine cell phone movements and credit card transactions into a data set that allow us to look at what percentage of folks are staying at home, for example. And that's what these maps are. And the maps in blue, or the areas in blue, represent places that are staying at home more during the pandemic. Next slide. And then you can also just see overall mobility trends, just how many people are just traveling to other places. Next slide. And this includes, they can even categorize places by types of industries. So we can see, how reopening strategies are affecting different industries in different ways. And let's go to the next slide. Neighborhood Nexus, that's another great place to start in finding out all the data resources that we have. So we have our open data portal that has really just kind of the raw data and links to some of the visualizations. Neighborhood Nexus is very similar. We have a COVID-19 response page. Next slide. And on this COVID response page, we really have a bunch of tools on there that, number one, talk about, okay, where are our medically vulnerable populations? Where are they concentrated? And that's what this map looks at. The next map on the next slide shows you where our economically vulnerable populations are. And those are some of the questions that we got just immediately. I mean, like day one of the epidemic, we started getting folks from the food insecurity kind of system, people from caring about seniors and older adults and how to get services to them, schools, housing. So they were really interested to see where these vulnerable populations were. So we stood up a couple of maps from that. Next slide. We also created some lightweight economic modeling tools, and this is what this is. So we created a tool that's just a basic input-output multiplier model. So you could see, for example, if you took down air transportation by 5% in Metro Atlanta, what would the cascading effect be on the rest of the economy? Next slide. We also built a couple of public health focused tools that allow folks to just look at every single county. What are the confirmed cases of COVID? What are the new daily cases of COVID? Next slide. We created some simple kind of, next 7-day, next 5-day models to give people an idea of, well, are we really flattening the curve here? Next slide. And here's just another example of a simple model where we're sort of tracking confirmed cases to kind of a best fit line using the SEIR model. And then next slide. And then we also build another tool that allows you to sort of visualize how this spread is played out. We have it focused on Georgia, but you can actually take this worldwide and see confirmed cases, deaths, and each bubble grows and contracts based on the number of new daily cases. Next slide. And then finally, I'll end here. I'm not going to read this slide. We've just, with being a regional planning agency, we have lots and lots of stakeholders, lots of different functions within our building. So we have lots of workforce development functions, community development functions, economic development functions, and all of these stakeholders, all of our partners were turning to us, asking us to help them make sense of what is happening. And so here's just kind of an example of some of the other things that we've been doing. And that included helping local governments try to figure out how to do their business virtually. So we did a lot of work with our local governments. We did some maps of shelter in place of local governments that passed those ordinances. And so finally, and I'll conclude here, one of the key learnings that we've had is the value of community data. Now, it took a crisis for people to really galvanize around this idea, but consistently what we've heard is just how valuable of a service that we provide, because people really need to know, especially in times of crises, people really need to know what's happening, how can they do their jobs better, how can they serve people in need better, especially during this crisis. So what I'm going to do now is I'm going to turn it to Colby, and he's going to walk you through some of our heavyweight economic modeling that we've done to help our stakeholders get an idea of the potential economic impact of this. And again, I'm sorry I took so long. But take it away, Colby.
All right. Thanks, Mike. Hello, everyone. This is Colby Lancelin. I'm with the Atlanta Regional Commission. As Mike said, we do have other products that we put together. One of them is our heavy-duty modeling tool called REMI. REMI is an econometric model. We have a certain version of it. It's a 22-region, 70-sector model that we've used to provide economic analysis for our stakeholders and partners. But also, as Mike talked about with his overview, is that we use this as well to look at exploratory or building or developing other scenarios or looking at things from an anticipatory standpoint. So we'll talk a little bit about our findings and what we've discovered and simulated and discovered using the REMI model as our economic analysis tool. So just a little background from what everyone knows already is that, the coronavirus first came about here in the States on about late January, early February. And with that, a task force was created at the national level and national leadership, and federal government had some intervention as far as from a fiscal standpoint, a monetary standpoint. And then the states decided that they needed to actually take some preventive measures and add some protective response to what's happening nationwide. So the states also became involved in taking a leadership role in this as well. With the REMI model, we also look at other models from Moody's and sorry about that, it's supposed to be IHS, not his, and RSQE. And then we looked at other exogenous assumptions, and from those assumptions from the University of Michigan and STR and some other economic arms, they were looked at anywhere from 0 to negative 1.5% decrease in GDP on an annualized base. So those are some of the things that we looked at and how we were really orienting ourselves in calibrating the model for what our findings would ultimately reveal. So methodology, we went with the REMI national forecast baseline in looking at potential recession scenarios. And then we incorporated the University of Michigan's RSQE's economic outlook into our calibration process for state and regional as well, not just the nation. And then we ran some simulations, and our analysis really concludes in at the end of 2021. So from Q2 of 2020 through the end of 2021 is really where our analysis focuses and hones itself. But we do have a convergence in 2022 where we revert back to an annual basis in our forecast horizon through 2024. So with that, we all know that they had Some certain sectors were really hit hard with this pandemic, and then we had some that were actually thriving with the pandemic. And to that note, we tried to separate those and really try to focus on those industries that were suffering and hemorrhaging during this time, and model that to see what that impact would be at the national level, and also how it impacts our region in the Atlanta area. And then we looked at those industries that were expanding as well, just so we could take a holistic approach to our modeling scenarios. Some other contributing factors that we looked at as far as our assumptions, labor force, the deaths. So we did look at it from an epidemiological standpoint, looking at case fatality rates, I'm sorry, and then also supply and demand. We know it's hit on both the supply side and the demand side. Normally with phenomenons and things that happen to our economy, we focus on the demand side, but this was unusual with this pandemic because it also hit the supply side of the economic footprint and landscape. And then the behavioral influence behind all of this with the social distancing, the physical distancing, the panic purchasing with people making mass purchases at stores, grocery stores throughout the region. And then how did we reallocate that consumption pattern inside of the model? Also, there was some policy involvement. Again, we touched on it a bit earlier, but the monetary implications, the fiscal implications, and then those behavioral implications we really wanted to look at and have that kind of steer our assumptions in modeling those scenarios. So here you'll see the framework, what we were working on, pretty brief. We developed 6 scenarios, but as the time went on and we started to learn more about this pandemic and how it was impacting the economic landscape, we decided to stick with the 3 that we felt most comfortable with as really illustrating what was happening at that point in time. So here you'll see that we have a moderate case, a severe case, and a critical case, and then the assumptions that overlay those events. And then we also look at what those conditions what may derive with those conditions from each case, and what that outlay would be from the overall economic picture, and then also from a production and trade standpoint, and then how do we classify that. So you'll see with the moderate case, we were anticipating a quick recovery. With the severe case, we had it more predicted as a V-shaped recovery, and then a critical case, which is the one that we're really still focused on refining, is the U-shaped recovery. Still not there yet with the V-shaped recovery, although data that's coming out in most recently over the week is suggesting that we may have a V-shaped recovery, but that's still hard to tell at this point. We still think the economy won't moderate that fast and rebound into that V shape, but more so like a U shape or a swoosh or even a W shape as we move forward into the future. Some of the assumptions that we looked at per event or per scenario, looking at the vulnerability, again, that's defined as us implementing those avoidance practices and also venturing into those remote working environments, which we all are in those teleworking environments. For those who are employed, sadly to say that we had a lot of people lose their jobs, but for the most part, people are working from home and teleworking. So we looked at that as an assumption, but also another assumption was that how did we really address or mitigate this pandemic and this virus, and how did we scale that? And for us, in our scenarios, we were saying that at this point in time, with these scenarios, we weren't looking at any type of treatment or vaccination being available at this point in time. And hopefully that's not the case. Hopefully we do have a vaccination or some type of therapy that comes out by the end of the year, but in our scenarios, we do not have that as of yet. For production and trade, you can see here, moderate case, we have a disruption, severe cases, congested supply lines, and then critical case, everything is just at a gridlock. And then the outcome from that, we're looking at a worse, pretty much the severe case, you know, it can be argumentative. We have some pros and some cons, some comments, some commentary around a severe case, and then a critical case really is our worst adverse case scenario with that U-shaped recovery. The timelines that you see here as we work through what we have, that quick recovery, it would be in the first quarter, that's Q2 of 2020, and then severe case stretching out to Q3, and then the critical case lasting into the first of the year. So just to put it in perspective, you can see here recession of 2001 from 9/11 in the hotel industry. They lost 400,000 jobs, 59% occupancy. Recession, the Great Recession that we just came out of, 470,000 jobs were lost, 54% occupancy. But now in this COVID, in this pandemic we're enduring right now, already 2.8 to 3.4 million jobs have been lost, and in a 25% occupancy. So you can see just from the magnitude and the scale of how hard hit we've been with this pandemic compared to other recessions that we've endured. And to take it a bit further, you can see here just from the state of Georgia, how we looked last year around this time in the March timeline, and how travel spending was at 135 million in March of 2019, and just a year net change, we're looking at negative $483 million lost thus far due to this pandemic. Here's some of the sectorial shocks that we implemented in our simulations. These are cumulative. So again, this is a dynamic model. So each and every iteration at a quarterly scenario or a quarterly outlook, we had to take that in consideration, and then again shock the model with the drop in output per sector. And here's some outcomes that we have, looking at it from the national standpoint, the US GDP growth. You can see here from each scenario what we were anticipating. The critical scenario, which is our adverse worst scenario, we were looking at just over 30% decline in GDP in the second quarter, very slightly increasing by the end of the third quarter to just under 30%. And then you can see that recovery, that U-shaped recovery through the fourth quarter, all the way through the second quarter of 2021. For Metro Atlanta, GRP, similar pattern, similar trends, but you'll see here in our critical case, we were just under 15% in peak Q2, and then we also stayed pretty relative to that in the third quarter of 2020. From the employment standpoint, deep trench in employment loss. On average, you're looking at the peak in Q2, a reduction of about 325,000 jobs lost. Toward the end of the year, we're looking at pretty much close to 500,000 jobs lost. So to sum it up, the economic outlook here by scenario, you can see in the critical case, we're anticipating just over 27 million jobs lost. In that peak Q2, about 30.3% decline in GDP, and just over 1.5 billion or trillion in income loss in that peak quarter, and then from the trough through Q4 of 2020. For Atlanta, the same, about 540,000 jobs lost, nearly 14% decline in GDP, and about 28.3 billion in disposable income loss. So what's next for us? We'll continue to collect data as it comes out. monitoring the economic indicators and conditions, and also continue to assess business restarts and reopening operations, and then those flare-ups and second waves. With that, we'll be happy to answer any questions, but I'll turn it over to Allie and Ryan.
Great, thanks, Colby. You could advance to the next slide. So good afternoon, everyone, and thanks for having us. My name is Allie Rego, and I'm a GIS and data analyst with the Natural Resources Group at the ARC. With me presenting is Ryan Sloan, planner and researcher with ARC's Community Development Group. So we're excited to share with you a unique project that we've been working on to really try and understand various local government responses to the COVID-19 pandemic in the Metro Atlanta region. But before we jump into the LGRI project details, Ryan will be giving us some more background info on how this project really came to be.
Thanks for that introduction, Allie. I'm excited to be here with y'all and to share one of the several COVID-19 related projects to have come out of Atlanta Regional Commission since March. If we could get to the next slide, Colby. The project that we're sharing with you is based largely off a similar one being conducted by Oxford University. In March, noting that the pandemic had prompted a broad array of various government responses around the world, a team of researchers at Oxford University set out to produce and maintain a database with up-to-date policy information that would track national government's responses to the virus. With the government response tracker, that research team from Oxford established a systematic index that they used to track government responses to the coronavirus pandemic across countries and time. The Oxford team created a series of indices that track various measures of the government's responses. These indices enable researchers to describe variation in the manners of their response and to explore how government responses that are different affect the rate of infection and to identify the correlates of more or less effective responses. And in simplest form, our project reproduces the Oxford study, but on a much smaller scale. Where they have examined government responses from over 150 countries, we're looking at the 20 counties in our MPO region. And while they currently have 4 related indices, we only produce 1 stringency index. We chose to engage in this study after a group of volunteers from ARC worked together to map the activity of our local governments in response to the coronavirus as a resource for the residents in our region. Upon mapping resources or responses like declarations of emergency, shelter-in-place orders, and non-essential business closures, we found that our region looked like a patchwork of disparate responses to COVID-19. And this is because in the earlier stages of the pandemic, like March, Georgia saw a statewide response that wasn't centralized. It left local governments to determine how they would approach the outbreak. So Allie and I decided to pivot from the original mapping project and to try to recreate the Oxford study, tailoring it for the actions that local governments take to slow the spread. Modeling the Oxford study, we have created a composite index with 9 indicators that measure the stringency of a local government's response. We perform our analysis on our member counties instead of all local governments, mainly due to the size of our team and the limited hours that we put into the project. Every indicator that we score is scored on an ordinal or a binary scale, which first looks at policy action and sometimes, where appropriate, also scores whether policy actions apply generally or target certain geographies or populations within a county. We then rescale each indicator's raw scores by their proportion of the maximum potential score, which creates a value between 0 and 1, with a missing value contributing a score of 0. And then the 9 indicator scores are averaged to produce that composite stringency score. We produce this data in a time series, so we have that composite stringency score for each county for each day since the beginning of March of this year. And then creating this time series has allowed us to compare the stringency of government responses to outcome data, like the infection rate. It's important to note that these indices have no capacity for causal explanation, but rather they can only measure variation in government responses. They can explore whether government response intensity affects the rate of infection, and they can identify the correlates of more or less effective responses. And then a final note before I pass it over to Ali. Because the pandemic continues to cause conditions on the ground to evolve so rapidly, the way that local governments respond changes quite rapidly too. So we've ended up making many edits to our list of indicators and how we'll define or measure them. You might see some strike through on some text in the cells that Ali's going to show you in a moment here, but I'll hand it over to her now.
Thanks, Ryan. Next slide, please. So as Ryan mentioned, we have 9 total indicators that we developed to score the stringency of each local county. And these indicators helped provide a systematic way to track these local government responses across space and time. So on this slide, you can see 6 of the 9 indicators, and each one has a scoring based on policy action in an ordinal scale, and for that policy's geographic or population scope. Most are binary values, with the exception of public gatherings. This was done to mimic the responses we often saw through local orders. So on this list, you can see we are tracking school closures, the banning of public gatherings, workplace closures, shelter-in-place orders, transportation, public facilities. Next slide, please. And then the remaining 3 indicators, which is public messaging, housing, and utilities. Now let's take a look at the data tracking. So again, we have the area, which is Bartow in this example, which is tracking the space. And then we have day representing time, and then the various scores based on indicators for each specific day. This allows a granular look at where each county was and their local responses on a given day. Next slide. So now we'll go through some preliminary results. And our preliminary results show stringency scores from 8 counties of the 10-county planning area from March 1st through May 15th. Next slide. And
All right.
I'll pass this off to Ryan.
Thank you, Ali. Yeah, and as Ali mentioned, these are very preliminary results. So as you can see on the bottom, we've concealed the names of the counties in order to not let out any sensitive information. And we also do not have the full 20-county region data validated yet, but we do have it collected. So if we take a quick look at this graph, which shows variation in stringency scores across time since March 1st, going up till May 15th. We don't have outcome data like the infection rate incorporated yet, but we can still glean some interesting information. You'll notice that there's a lot of heterogeneity before April 2nd. And that's signified by kind of the chaotic and crossing paths of the lines. And this is because, as we noted earlier, there wasn't a statewide response or a centralized statewide response. Sorry, I'm being interrupted by a dog. And forgive me, I was distracted. Okay. And on April 2nd, our governor released a statewide shelter-in-place order, which had a lot of extra stipulations in it. One of them being that no other order can be more or less stringent than his, and that this order was to supersede all other local orders. And then we see a lot less heterogeneity in the data after April 2nd. You might also notice that one county's stringency decreases after that date. It's that brown or rust-colored line. Upon investigating the data, we saw that the governor's order provided for slightly more lenient allowances for public gatherings than did that county's pre-existing executive order, which was superseded by the governors on April 2nd. So this was just something interesting because it's the only county we've looked at so far that has seen a decrease in stringency after the order was put into effect. And then if we could go to the next slide. On the next slide, we have a screen grab from the Oxford study. Once we've validated all of our data, this is going to be the next step. We'll start by comparing stringency scores, which are in red in the Oxford study, to the case rate or the infection rate in our counties. And it is our hope that this tool will help us produce some data-driven responses to future spikes in COVID or other similar and emergent situations. And I highly recommend anyone who's interested in this study follow that link at the bottom, and I'll drop it into the chat in just a moment. But for now, I'll pass it back to Ali.
Thanks, Ryan. So next steps, we'll complete our data validation, and then we'll continue to track local government responses and reevaluate indicators as needed. Again, mentioned throughout this webinar, this is a evolving situation, and we are aware that the current pandemic will be with us for the foreseeable future. As Ryan mentioned, we'll incorporate more data such as number of cases and deaths by county and potentially other data sets because as statewide restrictions are eased based on executive orders, there are still instances where some businesses are not going to open back up, and this isn't captured by this data. This is an example of how rescinding orders doesn't always mean people are acting as such, and is why we want to hopefully supplement these results with other data sets that may better track the actual behavioral patterns, some like Mike had mentioned earlier. And open it up for any questions. Thank you, guys.
Thank you to everyone at ARC. I'm going to quickly pass it over to Aaron at MORPC.
All right, let me make sure I've got the right screen here. Okay, hopefully you're seeing my screen now.
Yep.
Great. I'm going to be flipping between a couple of screens, so bear with me with a few transitions here and there. And right on time, my next door neighbor started mowing their grass, so apologies for any background noise. Just started like 30 seconds ago. So again, I'm Aaron Schill. I'm the Director of Data and Mapping at the Mid-Ohio Regional Planning Commission. And I'm going to talk a little bit about our response to COVID-19. I think what's really interesting in hearing the ARC discussion and the work that they're doing, which is phenomenal. One of the things that struck me is how differently our settings and our roles in the region and even state policies affect the work that we're doing. So I think there are some pretty clear differences that rise to the top. For example, in Ohio, at the state level, Ohio was one of the really early responders to the extent that the largest convention that occurs in Columbus was canceled during the week of the first week in March. And so we saw a lot of statewide policies go into effect very quickly that influenced the work that we did and how we saw our role in informing the work. So I'll talk a little bit more about that. Before I get there, just a refresher or just a little navigation aid for folks who may not be aware. So MORPC is the regional council for Columbus and Central Ohio. So we cover a 15-county region, and that's Columbus in the middle. And that's a quick list of the broad topic areas that we cover. But moving on to our work in around COVID-19, I'm going to talk, I'll get to our data resources in a moment, but I want to talk about a few of the other ways that we're providing support to our members. And that has taken the shape of our most frequent touch-ins, which are weekly update calls geared towards specific local governments in Central Ohio. So every Tuesday since mid-March, we've been hosting a call for counties and townships in partnership with the local township association. And then every Thursday, we've been holding calls for cities and villages, along with the Mayors and Managers Association here. Those are about to move to every other week, but those calls have been a great touch point to allow questions and conversation to happen in a frequent enough basis that we can be pretty responsive as conditions change. The other thing we've been able to do is have both state and federal representatives on, so congresspeople, senators, and key local leaders from the health department and from other offices give updates on what's going on. So we've been able to keep our members pretty in touch with policies as they're evolving and with other changes that are happening. So that's been a key touch point for our members, but it's also informed our work quite a bit. And when I get to talking about our data resources, I'll share some more on that as well. We've also been holding recurring calls. So our data and mapping team has organized recurring calls with some other key partners on the economic, demographic, and growth impacts of COVID-19 and the shutdowns. And I have a whole slide on that, so I'll move on to that in just a moment as well. And then finally, one of the other key pieces of work, which I heard ARC mention as well, is sharing our own experiences. So We are an office and have employees just like everybody else. So we, along the way, have been trying to be as transparent as possible and share as much information with our members as we can. So that started with remote work and helping to inform local governments on how to conduct remote meetings, providing guidance there, which at this point we're not doing so much anymore, but that was a huge way that we could provide support initially. We went through the PPP loan process and received a loan ourselves, and so providing guidance and insight into that. And then now as we're crafting our reopening strategy, we are providing guidance and insight into that experience and how we're working with our staff to do that. One of the things that we're also doing is conducting a telecommute survey that's informing our own telecommute policies, but also helping to gauge telecommuting practices as a result of COVID, but also coming out of that and what might turn into more permanent policies going forward as well. So let's jump to our more specific data resources. So in just a moment, I'm going to pull up our resource hub and just quickly run through some of the resources, the types of resources that we have. I'll just very briefly touch on a couple of them and leave it to you to explore more. You can get to it through either the link at the bottom of this page or just going to MORPC's homepage, and there's a link to it right at the top. But just for some context setting, I mentioned that the calls that we've been holding have really informed our work on this. We were actually really hesitant to develop our own set of resources initially. We saw the Johns Hopkins map come out just like everyone else did. There were some really great resources coming out of the Ohio Department of Health and other state agencies here. And initially we were hesitant to develop our own resources because the last thing we wanted to do was to add noise or just put one more dashboard out there that was essentially pulling the same data as everywhere else and create confusion about where to look for authoritative data. On those calls though, what we started to hear from especially some of our mayors and city managers was we are getting inundated with information, data, and we're not quite sure where to turn. I don't know what to trust and what not to trust. And so there was a call for MORPC to put together a set of resources that's geared specifically to local government needs and that's focused specifically on Central Ohio. So everything you see in our resource hub goes through that lens when we consider what we're going to include or what we're going to maintain. So let me switch screens quickly and pull that up. So here's the hub. For those of you who are Esri users, it should look familiar. This is using Esri's hub site. We began with the template that Esri provided for COVID-19 hubs, but we've essentially customized everything. So we're using some very, very little from what was in that template, but it was a great way to start and kind of base some of what we considered including in the content. We're jumping all over the place. So what you'll see once you get past the top is we still want to have case information right up there for people who want to track that, especially as reopening strategies are starting to be implemented. So we're tracking Central Ohio specific cases on a daily basis, and we have feeds from a few data sources here. We're now predominantly relying on the Ohio Department of Health data for that. I won't go into detail. It's pretty similar to other case tracking, but just focused on our communities and the ability to filter to different communities and with a little bit of key demographic information. Beyond that, though, we have a section that is a set of resources specifically for local government. So some of the analysis that we just heard from ARC, we're representing a little differently, but we're looking at, we have mapping of policies and declarations and other things enacted by local governments. And this is a way through several layers in this web map. It's a way for our communities to see what their peers are doing and consider what policies might be most appropriate for their own communities. We just recently added a page with reopening strategies. So let's pull this up quickly. A lot of the resources on this are pretty straightforward and simple in that this is essentially just links to a page on our site where we're compiling resources that we think are most beneficial for local governments and answering questions they have around reopening. So we've got just a number of resources from different agencies in Central Ohio with funding and other details about, in this case, specific to reopening strategies. Next to that, we have on the local government resources section. We've got a few other links. I'll also pull up this survey that we did of local governments to kind of gauge the impacts that they were feeling and impacts they were anticipating as a result of COVID-19 enclosures. So we did this survey at this point about a month and a half ago, I think. We're at almost 2 months ago now, wow. And we do plan to conduct this survey again to check in, but essentially we surveyed respondents on impacts to their staffing and whether they have had staffing impacts to that point, whether they anticipate staffing impacts in the future, and then the ability of their staffs to work remotely if they need to. So this starts to get at that essential worker role and helping to inform potential layoffs and furloughs, particularly as while the closures were in place, as things reopen, now we're thinking more about this from a budgetary impact. We also looked at impacts on operations, what operations had been altered. Again, we're starting to see some of these drop off. And the ability to conduct meetings remotely in an effective way. Those are still predominantly happening. Public meetings are predominantly happening remotely now still in Ohio. And then looking a little forward, what are the concerns for local governments going forward as a result of COVID-19? And we had some other questions about budgetary impacts and things as well. And so for each of these, we can filter by type of government and also size of organization. We specifically decided not to ask about for individual organizations to identify themselves, particularly because we knew we were going to be asking about budgetary impacts, delivery of services, and staffing impacts. And sure enough, the day after we released that, we got a request from the media for the survey results, and that was the exact reason we didn't want to have explicit information about individual local governments. So moving beyond the local government resources, I'll highlight the next section, which I'm not actually going to open any of these. Oh, there's a cat out front. We have a number of community resources as well. So these, while still geared toward local governments, what we wanted to do was think about what are local government leaders going to need to answer for their residents and be able to provide resources about. So information on childcare, on food resources, on the capacity of our healthcare system, and then a number of other links to things as well. So that's just to highlight a few of the resources that we have. And then we're also tracking utility shutoff moratoria. Right now I have electric pulled up, but we've got mapping of for each type of utility. Oh, it's refreshing. So we have information for natural gas, electric, water, and internet service, and by provider, what type of programs have put in place, or if we weren't sure of programs for the smaller providers. And that way people can see what the specific programs that affect them are. We have some other transportation resources as well, partnering with our transit agency, and then just links to some other key data resources. So I'm gonna pull up the, jump back to my slide deck here. So then just to touch on a couple of other areas of our work, digital inclusion and digital equity has become a really front of mind issue for a lot of folks in our region. And we've seen our role over the past few years grow in this, and it positioned us really well to be leading and informing those conversations in the past few weeks as this has come front of mind, particularly as we prepare for the upcoming school year. So there's a meeting every week that our executive director is a part of with other leaders of anchor institutions, thinking about how do we address digital equity needs broadly. And we're partnering with a nonprofit to get devices out. And then we're also partnering with that same nonprofit and a few other partners to look at district-wide options for broadband access going forward. Apologies again for the lawn mowing in the background. And then the final piece I want to touch on is looking at the lasting impacts and the economic impacts of COVID. As I mentioned on the first slide, we've been convening a group of partners for a couple of months now, thinking about, even as we react to the immediate impacts, what do we need to be considering as a region going forward? And so that's a list of the partners that have been a part of that conversation. As it says on the slide, those started out as pretty informal coordination calls. So we do not cover economic development, for example, for our region. That's handled by One Columbus, our regional economic development entity, who's a peer of ours and a close partner. But with all these partners, we want to talk about what are we looking at, what are they looking at, and what data should we be tracking as we consider impacts on our region. Just today, we had a conversation with those folks about transitioning that to a more formal approach. And the form that's going to take is a series of policy briefs that we put together using the expertise of all these different partners to then inform our decision makers, our elected leaders, and leaders of anchor institutions about not just what do we need to be thinking about now and what are the health impacts, but looking forward, what are the, within topic areas like housing, transportation and mobility, small businesses and employment, what are the 3 to 5 top considerations that we as a region need to be considering and developing policies for now to address the next year or 18 months and kind of doing that risk assessment and starting to think about policies around those. So that's where our work is going in that arena. And I know we're short on time, so I will pause for now and can answer questions at the end, but I will turn it over to our colleagues in Florida now.
Thank you so much, Aaron, and thank you to MORPC. Again, I'm just going to keep things moving and pass it over to Jennifer.
Okay, good afternoon, everyone. So I'm from Central Florida, and just a map of the state of Florida. We are the only region without a coast. We have 5 counties. There are 10 regional planning councils in Florida. Again, we're in the center of the state. This is kind of a snapshot of our region. We have close to 900,000 people in our region. We are more rural in nature. Polk is our most urban county. And these are the cases of COVID-19 today in our region. So our surrounding counties, Orange County, Osceola County, Hillsborough, Tampa, and Orlando areas have much higher numbers. And we, from a data standpoint, definitely use our health department's dashboard, which has been very, very helpful. We have not reinvented the wheel. You can click on your county and your zip code and see the number of cases that you have daily. We are still peaking. When we opened back for business, we continue to increase. As part of our reports to the region, each month we take a snapshot of the region and the impacts. We have, over the past few months, still seen quite a bit of activity in the development community. Just kind of a snapshot of our 5 counties. March was the highest month for permitting. April was a little quieter, but we're picking back up in May, and we're looking at June numbers now. And looking at housing starts and sales, we've looked at a 12-month review pretty much, and we are lower with housing starts and sales, but we're keeping an eye on that in our region. With regard to sales tax collection for our state, we are seeing a reduction, and we anticipate that will continue. Just looking at unemployment rates in our region, our more rural counties have seen less of an increase, about 3 to 4%. Our most rural county, Polk, has seen over 10% of an increase. And Polk is more service-based. With regard to our region, we have a grassroots initiative called Heartland 2060, and we have initiated a survey that has extended April, May, and now June. And through that survey, part of it was transportation based, and it was drafted before COVID-19. But we continue to see demand on roadways, but I think more so we're seeing with the latest survey results, and this hasn't been updated, but more of a demand on complete streets. We have a lot of folks staying home now and recreating in their neighborhoods and communities, and seeing that need for greater street complete street treatments. Looking at our economy, as of COVID-19, we're seeing less of an emphasis on tourism and ecotourism. And as we look at our economy, our community sees more of a demand on healthcare and more of the trades and fields that are not necessarily service-based. When we look at high-speed internet, this is a map of our region as we continue to work with providers, but the purple is where we do have coverage. We have a lot of our region that is not covered, and in these more rural counties, it is really difficult for school children at this point for that online education. And from our survey, we've noted this is really becoming critical as we look at opening schools in the fall, but making sure students have access as they go back into the classroom and also study from home. So that is just a very quick snapshot of our region with regard to the CARES relief. In Polk County, our most urban county, funds are being allocated, but we have a ways to go. And that is just very brief as we close out this session. Thank you.
Thank you so much, Jennifer. We do have one question. I believe this question was for ARC. The question is, how have you compared SafeGraph data with other providers that are attempting to categorize and measure social distancing?
Yes, and this is Mike, and I hope I'm unmuted. We have taken a look at it. I mean, the main thing that we've compared it to is the Google COVID mobility report, which is essentially tracking the same thing. And we've also compared it to the Opportunity Insights kind of COVID response page. And it's different. The trends, the directionality is the same. But, the levels are just a little bit different because they're just a little bit different data. And each one is trying to do slightly different things. But if you look at the totality of it, like comparing the Google mobility reports with SafeGraph, with some of the Opportunity Insights data, it's kind of telling the same story.
Okay. And if anyone has any follow-up questions, please feel free to reach out to anyone on this information page. I just want to thank everyone for joining today's webinar, and I especially want to thank the folks from ARC, MORPC, and the Central Florida Regional Planning Commission for sharing some of the great work that your organizations are doing. Participants should receive an emailed recording of the webinar in a few days, but it will also be posted to our website and YouTube channel. So again, thank you everyone for joining. That concludes our webinar today.
Thank you.
Thanks, everyone.